This is SSN
Story Studio Network.
Welcome to the Fatigue Fixer podcast. Have you ever wondered why you and most of the women you know seem tired so much of the time? Well, this is the podcast where we explore why. I'm here to help you better understand how your body works, whether we're talking about heavy, painful periods, why you have to pee all the time, or what the heck is happening to your body through perimenopause. And I'm not afraid to shed light on conversations that I feel we need to be having out in the open. Like, why are so many women struggling with irritability and anger, drinking more alcohol, and injecting our faces with Botox and fillers in an attempt to stay young? I'm your host, Dr. Sarah Vadeboncoeur. I'm a naturopathic doctor, mom, fatigue fixer, and loud and outspoken woman who's fascinated by the state of modern women's health and well-being. I know that you, yes, you, are incredible, and I want you to have the energy you need to share your unique gifts with the world because we are in desperate need of more female leadership. So join me for conversations that will help you feel less alone, more informed about all the things that might be draining your energy, and inspired to fix your fatigue and wake up every morning feeling rested and excited for the day ahead. I can't wait to share today's episode with you, so let's get into it. Today, I'm letting you in on one of the conversations I have every day in my office with my patients. We're talking all about our periods because, let's be honest, even though the average woman will have 480 periods in her lifetime, we still don't know much about them. Like, is it normal to have to wear 2 pads at night or feel a gush of blood when you stand up? So let's get into it. I think one of the most shocking things for my patients is when I tell them that periods really shouldn't be painful. A little uncomfortable for sure, but pain really should be minimal. And if you're experiencing enough pain that you need to take medication or it interferes with your ability to show up at work or at school, then that's not normal. And that's a big theme we're exploring in season 2 of the Fatigue Fixer. Things that we've all just assumed are normal, but are actually making us sick and tired. And first up are menstrual cramps. So why are periods painful? During your menstrual period, what's happening is that your uterus is contracting to help shed the lining. And part of what's being released are inflammatory molecules, which basically help the uterus muscles to contract. The thing is that when there's inflammation, there's also pain. And so women who have higher levels of these inflammatory molecules are going to experience more pain, more menstrual cramps. And there's a few different reasons why you might be having menstrual cramps. One that we're going to talk a lot about today is endometriosis. And endometriosis is a condition where the tissue that normally grows inside your uterus starts to grow outside the uterus. And it can grow on your fallopian tubes, your ovaries, or really anywhere in your pelvis. Pain can also be caused by having fibroids or adenomyosis, which is a condition where the lining of your uterus starts to grow into the muscle wall of the uterus. And you can also have pelvic inflammatory disease, which is usually caused by sexually transmitted infections. What's not causing cramps are your actual hormones. I know we all like to blame our hormones for a whole bunch of things, including menstrual cramps, but that's really not what's causing the pain. And a lot of times women think that it's because they have too much estrogen or estrogen dominance. But again, the pain is being caused by inflammation. It's really not being caused by your hormones. So let's talk about a common cause of menstrual cramps that we do a terrible job of diagnosing in women: endometriosis. So what is endometriosis? Like I said earlier, with endometriosis, the tissue that should grow inside of the uterus starts to grow outside the uterus. And this tissue is very sensitive to hormones. It's not caused by hormones, but it is responsive to hormones. And so it grows and it bleeds in sync with your period. So what are some of the signs that you might have endometriosis? The first one would be painful or even debilitating menstrual cramps, which usually get worse over time. I've had patients tell me they're literally lying on their bathroom floor and vomiting from the pain. That is not a normal part of getting your period. You might also find that you're getting pain either during or after sex. You might get pain in your intestines or your low stomach, painful bowel movements, or even painful urination during your periods. And this is often, again, because some of that tissue lining is actually sitting near your bladder or near your rectum. You might also get heavy periods, spotting between your periods or before your period. And someone with endometriosis also find that they have trouble getting pregnant. So how common is this condition? It's expected that about 10 to 15% of women are going to have some of this endometrial-like tissue outside of the uterus. And the women who are most at risk for this are women who have either a sister, a mother, or a daughter with endometriosis. You're also more at risk if you started your periods at an early age, usually before the age of 11. If you have a short monthly cycle, less than 27 days. If you have heavy periods that last more than 7 days, or again, if you've been told that you have infertility. And the reason I wanted to do an episode on this is that women are suffering unnecessarily. So women suffer an average of 8 to 12 years with menstrual pain before they even get assessed for something like endometriosis. It takes women an average of 8 years to receive a diagnosis of endometriosis. That was what happened to my patient, Emily. That's not her real name, but I've been working with Emily for many, many years, and she's been struggling with extremely painful menstrual cramps for a long time. And finally, we were able to get her referred to a gynecologist who finally diagnosed her after 8 years with endometriosis. And you know what he said to her? He said, number one, I'm sorry. And number two, what took you so long? And what took her so long is that most women have to beg and plead and see multiple doctors before they are referred and worked up for something like endometriosis. So 47% of women with endometriosis have seen at least 5 doctors before they get an endometriosis diagnosis or referral. And part of the problem is that we have normalized and dismissed women's pain. Women are much more likely to receive a medically unexplained diagnosis, aka we see that something's wrong, but we don't really know. And doctors are also more prone to disbelieve women's pain, and they're more likely to tell women or to label women as having psychogenic pain, aka it's all in our head. You're just making it up. Calm down. And they've done studies where they've literally polled doctors, and doctors have described women in pain, specifically with endometriosis, as hysterical, emotional, complaining, not wanting to get better, malingerers, and pain fabricators. In other words, you're making it up. It's not that bad. Take some Advil, suck it up, and get out of my office. And a huge part of why we are so terrible at diagnosing this is the actual diagnosis. And so right now, the gold standard for diagnosing endometriosis is laparoscopy. And that is basically exploratory surgery where we cut you open and we go have a look and we see whether or not there's any endometriosis. So obviously, this is not something that we're going to give or do for every woman who has menstrual cramps. A lot of the problem is that endometriosis is hard to diagnose and women are being dismissed when they complain about menstrual pain. The good news is we are starting to use diagnostic ultrasound and MRI, which are going to be obviously more accessible and less invasive ways that we can assess and diagnose endometriosis. But it's really important for you to know that regular ultrasound does not see endometriosis. So if you've had a regular pelvic or vaginal ultrasound and they've been you've been told everything is normal, that doesn't mean you don't have endometriosis because, again, we can't pick it up on a regular ultrasound. Once you get a diagnosis, if and when that happens, the good news is there are treatments for endometriosis. And again, I think this is really important because so many women are suffering with severe menstrual pain because we have been told that that is normal and that is part of being a woman. And again, you just suck it up and you go on with your life. Endometriosis can be a debilitating painful condition. And so women who have it absolutely deserve to get proper treatment. There are medications that can be helpful. Birth control can be helpful for some women. And then surgery can also be really helpful where we literally remove the endometrial tissue. Now that you know that painful periods aren't normal, I want to chat about what is normal when it comes to your period. A normal menstrual cycle should last somewhere between 24 and 38 days. And when you're counting your menstrual cycle, you should be counting from the first day of your period until the start of your next period. So we're not counting the days in between your period. You're counting the day from the start of your period until the next start of your period. And again, that should be somewhere between 24 to 38 days. And then your actual period, so your bleed, should last somewhere between 2 to 7 days. And over that time, you should lose somewhere between 5 and 80 milliliters of blood. Now, to put that in perspective, because most of us are not measuring our menstrual blood, it's somewhere between 1 teaspoon and 5 tablespoons of blood loss. And I know what some of you are thinking, a teaspoon? Like, there's no way, I'm losing way more than that. And you might be right, because another thing that we have completely normalized are heavy periods. A lot of women are dealing with very heavy periods, which are draining literally. They're exhausting, and they're making you more at risk for iron deficiency, and they could be a sign of something more serious. So let's chat now about heavy periods. Up to 1 in 3 women will experience abnormal uterine bleeding. That is the fancy medical term for a heavy period. And most often, this is going to happen either when we first start our periods at puberty or during perimenopause. And stay tuned for the next episode because it's all about what you can expect in perimenopause. So the signs of a heavy period, how do I know if I have heavy bleeding? So there's a few different things we can look at. Number 1 is the number of pads or tampons that you're using. So if over the course of your entire period, you are soaking more than 8 super pads or tampons or 16 regular pads or tampons, you meet the criteria for a heavy period, okay? Not 8 pads in a day, 8 pads or tampons in your entire period. If you're using a cup, the Diva cup, if you fill it 2.5 times, that is a heavy period. And the Nixit cup is actually quite big. It holds about 70 milliliters of blood. So if you are filling the Nixit more than once, you are qualifying for a heavy period. Now, if it's hard to tell and you haven't counted all your pads and tampons, there's some other ways that you can tell if your period is heavy. The first one is if you need to change your protection more than every 3 hours. If you have to change every 1 or 2 hours, you're probably dealing with a heavy period. If you're bleeding through your protection overnight, or you have any sensation of flooding, which is when you stand up and you feel that gush of blood, those can all be signs that you have a heavy period. And it is really important to seek help for this if you're finding that your bleeding is lasting longer than a week. So if your bleeding is more than 7 days, if you're changing your pads or your tampons every hour, if you're wearing more than 1 pad, or you're one of those who wears the super tampon plus the pad for backup, or if you're passing larger blood clots. So usually the size of a grape or larger could be something of concern. So what's causing these heavy periods? Why are we getting heavy periods? The first place we want to look is there something going on within your uterus that's making you bleed a lot? So that could include things like polyps, fibroids, adenomyosis, And that's basically a condition, again, where the lining of the uterus starts to grow into the wall, the muscle wall of the uterus, and that can cause pain and heavy periods. Or you could have endometrial thickening, which is basically where the lining of your uterus is thicker than it should be. And obviously, when that comes out during your period, it's going to cause very heavy bleeding. The first thing we want to do if we suspect or we find out that you have heavy bleeding is we would ideally want you to have a pelvic ultrasound so that we can look for some of these things that are happening in the uterus. If we see that something is suspicious, then we might also do a uterine biopsy where we take a little sample of the uterus lining just to make sure that there's no signs of cancer or anything like that. The second reason why you might have heavy periods are by things happening outside your uterus. So this would include clotting disorders, although those are relatively rare. If you have a problem ovulating, so for example, if you have something like PCOS, which is polycystic ovarian syndrome. If you're in perimenopause, which again, we're going to talk about in great detail in episode 2, so stay tuned for that. If you have hypothyroid, you might have heavier periods, or if you have high prolactin. So prolactin is the hormone that we normally make when we are breastfeeding, but some women continue to make it outside of breastfeeding. And often we might suspect that you have high prolactin if you get really full, sensitive, enlarged breast prior to your period. And also if you get a lot of headaches or blurry vision, those could be signs of high prolactin. And that's a simple blood test we can do to check for that. It's really important, number one, to pay attention to how much bleeding you're having, because again, most of us haven't really gone around talking to our friends about how many tampons are you blowing through on your period, right? No one talks about this stuff. So a lot of women don't realize that they have heavy periods. And unless you have a practitioner asking very specific questions, it's usually going to get missed. So it's really important that you, number one, start tracking to see if you are dealing with a heavy period, and that if you do have a heavy period, that you get some treatment or assessment for it. For a couple of reasons. Number one, it can really improve your quality of life. So no more worrying if you're bleeding onto your chair during a meeting that goes overtime, or worried about what pants you're wearing when you have your period. And if you treat your heavy periods, you're also going to help keep your iron stores up, which is a really important part of keeping your energy and your mood up. There are lots of different things that we can do to treat or manage heavy periods. I always say when I go through this list with my patients, I say, you're not going to like some of them, but it's what we've got. So I want to share the list so that you know what your options are if you're dealing with heavy periods. The first one is the IUD that has progestin, which is a synthetic progesterone. So for example, the Mirena. IUDs are very effective. They're one of the most effective tools we have for helping to treat heavy periods. So they can actually really significantly reduce the bleeding. For some women, they stop bleeding altogether. And they can be left in for up to 5 to 7 years. So that can be a great option for some women. We also have the birth control pill, which can really help reduce heavy bleeding. There is a prescription medication that you can get through your family doctor called tranexamic acid. And this one is great because you only need to take it around your period. You don't have to take it every day. And it can reduce blood loss by up to 50%. So it can be really effective. And the main side effect with that one is usually a little bit of digestive upset. And then if we're looking at things that are available kind of over the counter, we have naproxen or Advil, as well as ginger capsules. These all can be really helpful at helping to reduce not just your menstrual cramps, but also the amount of bleeding. And again, the nice thing with these is that they only need to be taken around your period time. Now, if all of these things are not working and your bleeding is really out of control, that's where we have some surgical options, which includes uterine ablation. That's basically where we burn the lining of the uterus so it becomes so thin that most women won't bleed for many years after. Or we can also do a hysterectomy, which is where we just take out the uterus, no more bleeding, no more uterus, you're done. So really important for you to know your options because, again, you don't need to just deal with heavy periods. You don't need to be doubling up your pad and tampon and waking up in the middle of the night to change your pad. Again, these are things that we have normalized that are not normal. So if you do have a heavy period, I just want you to know that there are lots of ways that we can help to manage that. And again, one of the reasons that I assess and treat a ton of heavy periods is because I treat a ton of iron deficiency. And I can't believe it's taken me this long to do an episode on this because it's literally one of my favorite things to talk about. But iron deficiency is incredibly common. And so one of the reasons it's so important to track your periods and get treatment if you do have a heavy period is that it's one of the leading causes of iron deficiency among women. And yes, even if you're a meat eater, you can absolutely be iron deficient. In fact, most of my patients are meat eaters, and many, many, many of them are iron deficient. And iron deficiency, in my experience, having been working with women for over 14 years now, iron deficiency is the number one physical cause of fatigue among women who have a period. So we know that worldwide, anemia affects about 30% of women of reproductive age, meaning who still have a period. And the number one reason for anemia is iron deficiency. But it's really important for you to understand that there's a very common misconception that if you're not anemic, your iron is okay. So I'll have patients say, oh, my doctor checked my iron, or they checked my hemoglobin, or I went to donate blood and I was okay. When you're going to donate blood, what they're looking at is your hemoglobin. All they're doing is making sure that you're not anemic. And again, if you're not anemic, that's wonderful, but it doesn't mean that you are not iron deficient, because anemia is actually the last stage of iron deficiency. By the time that you're anemic, you have been iron deficient for a very long time. So we want to make sure that we're not just looking at hemoglobin and saying everything is fine and then sending you on your way. The other thing that I find really sad, again, speaking of how much we normalize being tired, women are waiting an average of 7 months to seek medical care when they feel exhausted. Right? We are waiting 7 months of feeling tired before we go see the doctor. And then when we finally go see the doctor, up to 35% of women who have iron deficiency get a misdiagnosis. And there's a couple of reasons why this is happening. Number one is because our reference ranges when it comes to iron, meaning when you go to the lab and you get your iron checked and it shows you what's normal, those reference ranges are deeply problematic because they include numbers that are iron deficiency. So the normal range starts so low that you could be fully iron deficient and your lab will tell you that it's normal. So unless your doctor takes the time to look at the exact number, as long as you're in the normal range, you're going to get told everything is normal and you won't know you have an iron deficiency. The other reason we get a lot of misdiagnosis is that a lot of times when a woman is tired, we don't run any test. We tell her she's depressed. The number one misdiagnosis that women receive when they are iron deficient is depression. They're also likely to be told you're burnt out, you have anxiety, or you have chronic fatigue. And the problem with this is that when you get the wrong diagnosis, you also get the wrong treatment. And so a lot of women end up getting treated for depression. So they're put on antidepressants and they'll spend up to 2 years being treated for the wrong thing and then wondering why they don't feel better. And this is costing us dearly as women because women who have iron deficiency are more likely to miss work due to their symptoms, especially if you're misdiagnosed. If a woman is iron deficient, but she gets a proper diagnosis, she's not as likely to miss work due to her symptoms. And then 30% of women with iron deficiency find that they are not able to comply with their daily business, right? They really struggle because they feel so unwell to show up at work, to parent, to do all the things that they need to do because of their symptoms. And when we look at the symptoms of iron deficiency, we're looking at fatigue is probably the big one, right? The lack of energy, you get tired really easily. But you also might find that you have abnormal paleness. Your skin looks really pale, it's lacking color. You might find that you're more irritable. You might have an increased heart rate where your heart is beating faster than normal. You could have a sore or swollen tongue. And this is a really weird one, but you might also find that you have a desire to eat very peculiar substances, including dirt or ice. This is a condition called pica, where people are literally eating things that are rich in iron. And having iron deficiency anemia increases your risk of receiving a mental health diagnosis by over 50%. There is a massive connection between iron deficiency and mood. And again, when a woman goes to the doctor and she's like, I'm tired, I'm feeling kind of down, I don't feel rested when I wake up, we are often giving her the diagnosis of depression without even looking to see if she might actually be iron deficient. And again, when you're iron deficient, you're more likely to have symptoms of anxiety, depression. You're more likely to be diagnosed with a psychotic disorder and a sleep disorder. And women who have iron deficiency are also at higher risk for postpartum depression. So iron deficiency is not just about feeling tired and having cold hands and feet, which I didn't talk about in the symptoms. It literally is impacting your mood and the likelihood that you're going to receive another psychiatric diagnosis on top of that. One of the things I'm a big advocate for is that before you agree to start an antidepressant, please make sure that your doctor has run some labs, specifically to look at things like your nutrient deficiencies, again, iron, vitamin D, vitamin B12. You also want to measure inflammation because we know that people who have higher levels of inflammation actually are often more treatment resistant with antidepressants, meaning antidepressants don't seem to work as well. And we also want to screen for thyroid dysfunction, which can often cause a lot of the symptoms that look like depression. So this is not to say that you shouldn't take an antidepressant. They can be very helpful if you are dealing, especially with moderate to severe depression. But we should not be giving out antidepressants like candy without actually running any tests first to see if there might not be something else going on. When we look at what's causing iron deficiency, right? Why are so many women iron deficient? Well, I said it at the start, you're going to have 480 periods over the course of your lifetime. And because many women are having fewer children or no children at all, we're having more periods because we're spending less time pregnant and breastfeeding. And every time we have a period, we're losing blood. And in that blood, there's iron. So when we look at some of the main causes of iron deficiency, heavy periods is very near the top of that list. So as a reminder, by definition, a heavy period is more than 80 milliliters of blood loss. So again, in real life, that looks like soaking more than 8 super tampons or pads, or 16 regular tampons or pads, or filling your cup more than 1 to 3 times, depending on the one that you use, over the course of your entire period, not in one day. If you need to change your protection more than every 3 hours, if you're bleeding through your protection overnight, or again, you have any sensation of flooding, these are all signs that you might be dealing with a heavy period. And again, getting your heavy periods treated is a key part of preventing and fixing your iron deficiency. You could be taking an iron supplement for months and months and months. If you're dealing with a heavy period, you might have a hard time bringing those iron levels up. So it's really important when I'm helping someone work through iron deficiency, we're working on 3 different parts. We're working on making sure that there's enough iron coming in, so through diet or supplements. We're making sure that iron is being well absorbed by making sure that gut health and digestion are good. And then we're making sure that there isn't excess blood loss coming either through the period, through blood donation, or through some kind of digestive bleed. I love talking about iron deficiency because I'm legitimately convinced that we would literally change the world if we fixed iron deficiency, because so many women are walking around with iron deficiency and we are just used to functioning with very low iron stores and then wondering why so many women are tired. And again, a lot of women have technically normal iron stores and are still iron deficient, which I know sounds very confusing and frustrating. It's why I always request to see patients' blood work. I don't take it for granted that things are normal until I see the number. Because most of the women that I see in my office, and I've now treated thousands of women over the past decade, I would say on average, most women who still have a period have a ferritin under 30. And ferritin are your iron stores. And anything under 30 is considered iron deficiency. A normal iron store is above 100. And I can tell you, I think I've seen it 5 times, and it's almost always in women who have an IUD who don't get a period. I don't think I've ever seen a woman who has her period have a ferritin over 100, even though that is what is considered normal. And if you want to feel really angry for a moment, again, most women are walking around with under 30, carrying the weight of the world. Most men are walking around with the ferritin level somewhere in the 200 to 500 range. I would love to do an experiment where we, for 1 week, just dropped ferritin for a lot of men to under 30 and just see how they feel. And I think it would really help them to understand why we just get tired sometimes. So this is why I think fixing iron deficiency is such a powerful thing. It literally changes your day-to-day experience. It changes your energy and your mood and your capacity to show up at work and for your family and do all the things that you want to do, right? We shouldn't be surprised that so many women are tired and depressed and struggling to make it through the day, because most of us are iron deficient. And especially when we're on our period, we're losing even more blood and iron. So of course, we're going to be more tired. If you want to learn more about how to fix your iron deficiency, I created a program all about this because, again, I was having this conversation in my office every single day. So I put it all together in a step-by-step guide to fixing your iron deficiency so that you can have more energy, a balanced mood, and strong hair. Because that's the other thing. Hair loss is more common when your ferritin is less than 70, which, again, it isn't pretty much every woman with a period. The program is called the Iron Deficiency Fix, and it includes a bonus lesson on managing heavy periods. And you also get a copy of my 7 essential lab test guide, where I share basically what levels to aim for when it comes to your iron stores, and also the specific list of tests to ask your doctor for, so you can get a full iron panel and get really great insight into your iron levels. So I'll post the link to that in my show notes. If you remember one thing from today's episode, I hope it's that your period shouldn't be a pain. It really shouldn't be painful, and it shouldn't be so heavy that you have to think twice about what you're wearing or worry about leaving the house. I am so tired of seeing women dismissed or ignored when they are experiencing very legitimate symptoms. So if you're one of the women who's been struggling with painful or heavy periods for years and you haven't felt listened to by your doctor, I'm sorry. I hope that today's episode gave you more confidence to know that what you're dealing with is not normal, and that now you have a better idea of what to ask your doctor for. And if you're in your 40s and wondering if the period changes you've been experiencing are normal, hold tight. I'll be right back here in 2 weeks to talk to you about all things perimenopause. Talk soon. Thanks for spending your precious time with me today. If you enjoyed today's episode, it would mean so much to me if you would take a moment to leave us a rating and review, and share this episode with a friend who needs to hear it. If you're ready to get more insight into what's making you tired, find out which of the 5 most common types of fatigue you're dealing with by taking my fatigue fingerprint quiz at fatiguefixer.ca/quiz. Are you dealing with frazzled fatigue, where your body's exhausted but your brain won't shut up? Or maybe you're more of the drained fatigue type, where no matter how much sleep you get, you struggle to get up in the morning. Just take my fatigue fingerprint quiz and you'll have more insight into which labs to ask your doctor for and what habits and practices are best for fixing your type of fatigue. Find the quiz at fatiguefixer.ca/quiz. Because let's face it, accepting perpetual exhaustion as the norm, that's just not going to fly around here. Last but not least, I want to thank Jen Hudson and Mike Trutler over at Story Studio Network for bringing these conversations to life. I'll see you right back here in 2 weeks. Bye.